They say the world changed forever on this tragic day in September. Certainly it did for firefighters.
I don't know that things will ever go back to normal.
We lost 343 firefighters on 9/11.
It was very overwhelming, and yet at the same time, you just simply started focusing on the tasks at hand, and you kind of settled in and started doing the things you were trained to do.
We saved thousands of people that day.
When I was down at ground zero going through everything, it was something I never would have imagined happening.
Firefighters are no strangers to tragedy. We've dealt with disasters before 9/11 and since then. The sheer size of the World Trade Center and Pentagon disasters was the catalyst for change. The human problem simply could not be ignored. Before September 11, 2001, behavioral health had been treated as an individual concern and largely as an individual responsibility. But the loss in New York was so immense, it was obvious that its effect would be felt throughout the first responder system. The IAFF immediately took the initiative to study the effects of the catastrophe on firefighters and their families, and to gather information from other studies.
9/11 taught us a lot of lessons, and I think we're still digesting those lessons today. I think one of the things it taught us is that it's crucial to have a program in place prior to an event like that, of any kind of size. And I think that one thing that they had in New York was an existing program that they expanded and built upon. I think the second thing that we learned is that it's very important to address firefighters where they're at. You know, when we responded to that situation at the World Trade Center, it was still in operation. And so we were very careful not to go in and interfere with the process that that organization was involved in at the time, and we respected that.
From 9/11, we learned that it's not just firefighters who are affected by their line of duty work, it's also their families, and that in turn affects the firefighters. We learned that we need to provide services for the whole brotherhood and all its relatives that are affected.
The IAFF expanded its research to include other tragedies, the effects of stress, and to take a deeper look at the unique experience of professional firefighters.
In a second's notice, you have to be on the truck, responding to a call, getting somewhere in 4 minutes. It's either on fire, somebody's having a medical crisis, it could be a child drowning, and you have to have the ability to deal with all those moving parts. Well, you need to be physically strong, obviously, and in good shape to fight a fire, but you need to be emotionally intact to make the decisions that it takes to have the cognitive reaction under those circumstances, to be able to pull yourself together, to control your emotions, and to respond. Firefighters do that, and they do it in a pretty seamless way, but it doesn't mean that the job and what they do isn't taking its toll on the individuals, and we need to make sure that they're in balance with their lives, not just physically, but emotionally and mentally.
Several IAFF locals and their departments are expanding the scope of traditional CISM and EAP programs to produce a comprehensive approach to behavioral health with positive results. But trying to get individual firefighters into counseling has often proven difficult.
Firefighters, I think, are a real proud bunch.
It's not cool to need help.
So a lot of times the firefighter's not going to ask for help.
It's not us that are broken. It's somebody else is broken and we got to help them.
The IAFF is committed to delivering behavioral health services that are easily accessible, comprehensive, and free of any stigma.
A lot of guys needed help and got it, and I think guys see that now and say, well, you know, it's a viable thing. You know, we saw these guys, we saw these horrendous things that happened, and we saw guys that needed help and went and got help, and it's not such a taboo anymore to ask for help.
Under the new IAFF model, behavioral health in the fire service will be part of a comprehensive program of wellness and fitness.
That's one of the objectives of the IAFF, the behavioral health program, is to make our people healthy beforehand. You know, wellness, fitness, the healthier you are going in mentally, physically, and spiritually, the better apt you are to deal with the situation.
The new IAFF behavioral health model supports rehabilitation and de-emphasizes disciplinary actions.
Our philosophy, in a sense, is let's look at rehabilitation, not termination.
The system is rewarded by saving that individual in a very humanistic and practical way. A 15-year firefighter takes 15 years to groom with that experience. You don't get that overnight. I mean, it's responding on calls, it's dealing with people on the street, it's going to fires. So all that is lost if you lose that person that you're trying to help.
A program like this needs to be in place, it needs to be simple, and it needs to be effective.
Behavioral health programs should emphasize each person's resilient nature and the idea that most people have the capacity to cope with stress effectively.
I think one of the concepts from the old critical incident stress debriefing model that was really an error was that it really assumed that when people ran on those kinds of calls, which is typical for any firefighter, that they were going to be permanently injured for the rest of their careers, and that's just not the case.
Firefighters and human beings in general are resilient, so that even though there may be, just as there's healing from physical problems, there's recovery and healing from mental problems, and oftentimes that can be very rapid. So closing the book on an individual that has any kind of psychological difficulty is really potentially losing an important resource for the department.
Behavioral health programs should use a strength-based approach that will recognize that people already have natural support mechanisms for dealing with stress. Family, friends, fellow first responders, faith, and fitness. This approach enhances firefighters' ability to cope with stress by building on the healthy behavior patterns they have already established.
Sometimes the stress is channeled in a positive path, and you'll see people who work out very regularly, who are meticulous about taking care of themselves and taking care of their families and taking care of their support networks. They can build a program of training for themselves that guards their resilience.
It is no longer sufficient to confine behavioral support to critical incidents. The IAFF endorses proactive support of firefighters, beginning with recruitment and extending through active service into retirement, to provide a shield so that the strength is built in and available when it is needed.
I think every fire department should have a plan on critical incident stress management, whether they use it all the time or they've written a policy on when it's important, and that plan should have people that are trained to do those debriefings. They should have a chaplain available, either on the department or available to work with the department, that can meet the spiritual needs of the members when they're dealing with a crisis. They should have a very solid employee assistance program. So if they're contracted with a mental health provider, somebody that understands those providers, because if you can get a firefighter to agree that it might be a good idea to talk to a professional, they want to get in and out. They're used to being the heroes and to fixing things, so when they go in, they want to get fixed and they want to get out.
The fire service must recognize that emergency responders function as part of a family system and must address behavioral health from a family as well as an individual perspective.
One of the things that we've learned very strongly from the research we've done is that if you don't take care of the families, you're really missing a huge piece of what's going to keep fire department personnel operational.
Assistant Chief Joe Pfeiffer was the initial incident commander at the World Trade Center and lost his brother, also a firefighter, in the disaster.
The other day, my son and I were supposed to go out kayaking and was delayed because I had to do something for work for about an hour. And he got real upset, and he was saying, well, do you care about the firehouse more than me? And I think what he really was saying was, his dad, hey, listen, I need you to be with me. I almost lost you once, and I don't want anything to interrupt the time we have together.
One of the things that I found is through Worcester and New York and other places, some firefighters, that's all they want to do is get your cell phone to touch base with home. A 2-second call to their wife, to their mother, or to their kids changes the whole atmosphere.
They know that we come to work, and They're worried more now than they ever were, you know, and rightfully so. Firefighting is a dangerous job as it is.
A behavioral health program must include 3 levels of responsibility to be effective: departmental, firehouse or company, and individual responsibility.
We need to seek out or develop a clinician or structure of clinicians that understands what we do, the dynamics of firefighting, station life, the family life, and the pressures that we have to deal with, the unique and catastrophic situations that we see and have to take in stride somehow, and our families have to deal with. You need a clinician that's a specialist in that, just as you'd want the best heart specialist or cancer specialist.
And what that means is we're in front of them, we're doing trainings, we're communicating with them, we're eating with them, we're going on ride-alongs with them, we're participating in live burns with them, and we're really learning the culture and developing the relationship.
So having an active mental health component that understands and wants to work with the fire service is immense, because then those firefighters are free to go in and talk about whatever it is bothering them, whether it's a family issue or a work issue or a stress or a bad call, whatever it is, to be able to go in and share that and get some tools on coping skills on dealing with that so they can feel better and get back into life.
It's all ultimately about getting people back to work, because we don't have people that are looking to get out. You know, we have people that want to get back to work.
IAFF locals can help improve department-level responsibility for behavioral health in several ways. Through evaluation of existing practices and contract provisions, seeking support for education and training at all levels of the department, matching departmental SOPs to actual operations, and ensuring an emphasis on support and rehabilitation, not discipline and punishment.
It has to be widespread buy-in from across the board with your folks, and that's a union's role.
Unions and fire departments need to think on the same track in terms of mental health, behavioral health, and EAP. It's really not a low bid service. That's not what you want. You want a quality program that your members will trust and use. And it's best if the union and the fire department agree on that.
Firefighters have a system for helping themselves, built on relationships within the firehouse and the traditions of the service. In New York, FDNY retirees played a crucial role in helping active duty members get access to the support services they needed.
The retirees in New York played a phenomenal role. One of the functions was to go into every firehouse with the chaplain and a peer that lost a member or multiple members, to go in and assist. They did a fantastic job.
Behavioral health at the firehouse level begins with recognition that a fire company or tour is a unique work environment.
It's almost like having a family when you're in the firehouse.
When we work together as a team, we eat together, we live together for a third of our life in the fire service, you're together. And so when you have issues, it's like any other family member. When they have a problem, if it's your child or your brother, your sister, what have you, you help them. That's what you do as a family member.
Firefighters trusting one another, knowing that we've been through this situation before, or just the mere fact, being a Boston firefighter, you know, knowing that you've seen so many things that they're gonna feel comfortable talking to you about, because we've all been in the trenches together, and a lot of us have been in the trenches together.
While support at the departmental and firehouse level are essential, to be truly effective, behavioral health must function at the level of individual responsibility.
We actually have set up a structure where we call Friends Help, Friends Get Help. When you're the one that this is happening to, a lot of times you don't understand that. Things are just changing, you don't understand it. You can't figure it out. And so we've got a real friendly sort of an effort for our members to encourage, to kind of identify that and encourage someone that they work with in the station to, hey, you know, you ought to go and just talk to our counselor. You've got some stuff going on, and I don't want to get in your business. I'm not going to know if you went or not, but you really ought to do that.
The IAFF will continue to respond to the needs of members in times of catastrophe. In support of this new model of behavioral health, The IAFF has developed a variety of materials to assist fire departments and professional firefighters, paramedics, and EMTs. These can provide detailed help in dealing with many of the topics covered briefly in this video.
We feel that most firefighters will recover from this event. We think that many of them, they're going to need some help.
Because of 9/11 and some other events, now people aren't afraid to come forward and get the help they need, whether it's for themselves, for their family, marriage counseling, legal issues, whatever it is, substance abuse, there's help available.
We need to build a system where culturally the fire service starts to acknowledge that people are going to have problems, that's invariably going to happen with our line of work, and it's okay to step up and go try to get help and get treatment.
I think it's important for all departments to have access to something like this, because the job is the job. It's the same everywhere.
What's been put together is a proven record. A lot of lives have been put back together. Families are being healthy. The wellness of the fire department is growing.
It works. I've seen results in the time that I've been involved in it, and I've seen some people that have actually come to the union and thanked us openly at a union meeting for the help that we provided.
Your most valuable resource is your firefighters. It's not the trucks, it's not the hoses, and whatever it takes to preserve firefighters is of critical importance to any organization and department.
All of our members are professionals, capable and tough. In this business of ours, we think we're immune to the stress of the job. But no matter how strong we are, the fact is you're exposed to tragedy and trauma every tour. The loss of a brother or sister in the line of duty, or carrying the lifeless body of a child out of a fire has an impact on you emotionally and psychologically. To make sure you have the help you need, to make sure you know when and how to ask for help, and to ensure that you can trust those that you confide in, the IAFF created this support program. There are times we all need someone to talk to when the job starts to weigh on us. Honor and duty are not diminished by your need to obtain support from an effective program. I hope you'll use this resource when times get tough. Stay safe.
For more information, please visit our website at www.iaff.org.